My name is Dr. Denise Perdue, and welcome to Black History Month. This is the day that we're going to talk about COVID-19 and some of the challenges that we faced and why we're facing them, and get some really good answers and to answer some of the questions that you have. We know that some of you that are in the audience have some questions about that, so we have a great person with us, a local person, a female physician, and we're going to have Dr. Elise Brown Pruitt introduce herself to us, and we're just going to have a marvelous conversation about COVID-19.
Well, good morning as well, and I'm Dr. Elisa Brown Pruitt. I'm an obstetrician gynecologist and also associate professor of obstetrics and gynecology at Texas Tech University Health Sciences Center here in the Permian Basin.
I want to start off with, if I could, with reading a letter, if you don't mind. So Black History Month this month is about the Black movement. So we're talking about health, education, arts, politics, and literacy. And there was a letter that was written by a Black coalition. It started in the fall of 2020. And I just want to read you a little bit of an excerpt and then get your views on the letter. It's a love letter to specifically Black people. I'll tell you who was a part of it thus far. So get your opinion on that. And then if you could further elaborate on how do we build trust? How does your profession build trust with us? If I could say the commoner, I'm not in the medical field. I haven't studied medicine. I haven't studied research in terms of being in the medical field. But if you can talk to us about how are you going to build trust in me, one that's not in your field? So let me read it to you because I find it really interesting. So it was written by people that were part of Howard University, Morehouse School of Medicine, Meharry signed off on the letter, Charles Drew University, National Medical Association, National Black Nurses Association, and also the National Urban League. So here's what they said. We affirm that Black lives matter. And as Black health professionals, we have a higher calling to stand for racial justice and to fight for health equity. In the spirit of unconditional love for every single Black American, we have locked arms in an initiative to place the health and safety of our community at the heart of the national conversation about COVID-19. Respect for our Black bodies and our Black lives must be of core value for those who are working to find the vaccine for this virus that has already taken so many of our loved ones. Our colleagues across healthcare know that we are urging our community to take safe and effective vaccines once available. However, for this to be successful, they must do more to earn your trust now and in the future. So we're not trusting. So if you could respond to this love letter to those of us that are not quite trusting just yet, what would you say?
Well, first I would say that I agree. I'm a member of the National Medical Association and have been off and on since I was a student. I was a member of the student SNMA when I was in medical school. And that was a very nurturing thing because, I was not in an HBCU for medical school, so to be able to have those examples and to make decisions of how we were going to approach the community at an early time in my education, I think was important. And getting through to the community is something that National Medical Association and the other organizations that penned that letter really understand and have for a while. COVID brings everything into relief and has made it more urgent, but it's not an old thing for us to write love letters to each other and to bring our communities to the forefront, with our expertise and with our, elbow grease and with our love for humanity. So that's not a new thing. That's the first thing that I will say, but COVID makes it urgent. And what I would say is that trust is built with multiple components. And something that is systemic. The issues that have caused us as a Black community not to trust the medical establishment in general, and more specifically things like vaccination, is real. We'll probably get into it a little bit more, but you know, the Tuskegee experiment, and also experiments on enslaved peoples without anesthesia. Just historically, it's pretty horrific. And I think that Black people have a reason to be distrustful. But I also think that it's systemic in that I don't think that sometimes we have enough knowledge as a community. For instance, specifically with COVID, it's been brought up, you know, by several news outlets that the campaign to even inform people about COVID, specifically because we were way more represented in the front line, people who had to go to work and be exposed to COVID. I mean, you know that story about the bus driver who complained because people didn't want to wear masks, and who died maybe just 2-3 weeks later from COVID. You know, and we can talk about mask wearing and those types of behaviors, which are important. But even from the beginning, before we had the vaccine, we didn't get enough information. In the housing projects, there was nothing, not very much on the radio. Most of the public health campaigns by our national and federal agencies were kind of, you know, pointed at people who had access to the internet and had a certain level of knowledge. The language that they used was not necessarily culturally sensitive. So we even got the message late. And then we're also living in situations where we couldn't social distance, you know, and then whole families would get COVID, and then they would pass it on down generations in communities of color. So I think the first thing is information. Okay. And the second thing I think is systemically, education has to be in the forefront. And we've got to understand science and math and technology more as a community. And that way I think we can take charge of the narrative, who's telling it, who's experimenting, and what we think is true or not. So
it makes a lot of sense. If you could go back and talk about yourself personally.
Oh, okay.
Why did I should have asked earlier, but why did you choose science? Why are you in the medical field? What was your interest in studying the sciences, and you stayed with it? Even though a lot of times, I know for me sometimes when you're thinking about going through biology classes, oh dear me, and the cells, it looks like a cell, it's just round, or what does it mean, and think, but you stuck with it. Why did you do that?
Well, I came to love science through medicine because I was just lucky. You know, we didn't have a whole lot of money. I wasn't a Cosby kid. I had put myself in college and medical school, still paying loans. But anyway, we were kind of intellectually rich, you know, and my mom was a physical therapist. She was the first African American to graduate from the UTMB program in Galveston in physical therapy. And then she got a scholarship to Stanford in the 60s, dropping my age, and took us with her, you know. Okay. You know, we were in nursery school and things like that. And then my dad was a classical musician. He went to HBCUs, and he taught at Texas Southern University, another HBCU, and studied there. And he was a cellist, and then he taught music in Houston Independent School Districts, and was very, very innovative, and got members of the Houston Symphony Orchestra, all white, to clinic his urban, you know, coded Black kids in the 60s, early 60s in Houston, and was just a really innovative music educator. So we grew up with my mom, who was like a book nut, and I still am carting around, she's 90 years old, I'm still carting around a bunch of her books, and then, you know, and then the education from my dad. So we were always into like the books and the knowledge. Okay. Well, my aunt was a nurse and also a nursing educator, and she had this obstetrics nursing book that she had in school. And back then it was a little different. It's a lot more what I would call on the job training, and the academic part is in the school. But back then they did rotations just like medical residents do. And she had an 8-week rotation, and she had this thick book, and I was 4, and I would get in the corner, and I couldn't even read, but I was like, okay. I knew about forceps, I knew about deliveries, I knew how they happened, I knew where the babies came from, and it wasn't gross or scary, it was exciting, and I was like, I'm going to do this. And in nursery school, they said, well, what do you want to do? And I said, I want to be a baby doctor. I was 4. And they thought I meant pediatrician. I did not.
Okay.
And so it was a hard road. I'm going to say, you know, financially, academically, all of those things that sometimes impact us as people of color, you know, not having money to go to school and things like that. I had struggled through all of that. But I just kept on, because then the science was, wow, it was golden. And the why does this happen?
Right.
Why does this happen? I know why my hair is kinky underneath this, you know, lace front my stepdaughter put on me. Is, you know, because there's extra sulfur molecules in the, you know, amino acids. Wow. Dr. Bolton, and that means there's more disulfide bonds, and that makes my hair curlier, so that way when I was in the African sun or my ancestors, my hair could be fluffy and cool, but still protect me from the hot sun. You know, it's lovely. It's just lovely to know the why, and then to be able to use that applied science to help make people better and save lives, you know, and that's a little, you know, hyperbolic, but it's the truth. You know, we get to do that stuff every day.
Okay, let's go on and let's talk about that. You brought that up before with Tuskegee. So let me ask you this. Though marked by very different viral outbreaks, such as the Tuskegee syphilis study, the Mississippi appendectomies, and now the current COVID-19 pandemic, do they present striking similarities in terms of remembering the story about Henrietta Lacks, particularly to you as a Black female gynecologist?
I particularly think those two things are just a little bit different. I think they're very, very related.
Okay.
And they show a continuum of how, I think that the case of Henrietta Lacks, because she did receive the treatment, which is radiation for her cervical cancer, that was appropriate. And she did present at a late stage. But I think the dismissiveness of harvesting her cells from that biopsy without her knowledge and without her family's knowledge, and then when they went back and had some contamination of the cells in that story after using that cell line for decades, they went back to the family and wanted to use their blood to verify the cell lines. I mean, I'm like, come on, you know what I mean? So that's dismissive and a little bit I want to say dehumanizing on that intellectual level, and unfortunately I think that's where it starts. But then the continuum goes to experimenting on people and really robbing them of their autonomy because you think them less than human. And you cannot do those things if you think that person is equal to you.
Right.
Like the Mississippi appendectomies and the Georgia appendectomies that just happened this past year. It's still going on.
Yes.
It's still going on.
Sure.
I can tell a particular story, like, you know, when for Medicaid, that's a whole topic for a whole nother day, but when we do sterilization procedures or tubal ligations, we have to get the person to sign a consent form 30 days in advance to give them a thinking period. Well, now most of us as women would go, okay, that's real paternalistic. I know what this is my body. But the history of that is sterilizations were done unbeknownst to women, particularly women of color, and there is a harsh history of doing this to American Indian people.
Right. Right.
There are some reservations where up to 30 to 50% of the women were sterilized.
Right.
In Native American communities, and also coercion of Black women to sterilize to the point where that is a go-to even in our community, it's become so ingrained. It's a go-to birth control for us still.
That's
a lot
true.
of times because people
Right.
just want to have control of their fertility.
Right.
Right. And which, there's a debate about that, about autonomy. But what I'm trying to say is that there's a history of it being up to everything from horrific experimentation and without anesthesia to the more subtle thing of just taking someone's cells.
Okay.
I'm not sure that Henrietta Lacks was physically maltreated, and it's not that I'm trying to excuse the doctors at Johns Hopkins, but just that mindlessness of here's this human being who had this pretty hard life, and we can just use her how we want. I think people would dismiss that, and as a matter of fact, the panel that went back and looked at it said that there wasn't any misdoing. Couldn't even see it.
Right.
So we go
Exactly.
from that,
Right.
and it just makes it easier to do the next step than the next step. So I think
Right.
they're related. They may not be exactly the same, but they're certainly related, and it's a dangerous getting to the edge of the cliff and then falling off the cliff of how we treat one another in the medical world.
Indeed. So bringing that trust element here as well with COVID-19 and the pandemic, and trusting our physician, trusting our nurses, trusting them at the front desk, is it that you're stating that we have to feel comfortable asking a question and feeling comfortable with those that are going to give the answer, giving that to us in a manner of we can understand it? Because there's that trust issue part of, in terms of whether or not I can believe that this vaccine is going to work for me. I believe it's going to help me to prevent me and my family members from becoming ill. But are you saying that, are you sure I'm not going to get sick from it? Are you sure that it's going to work for me? Are you sure that I can trust you? And are you sure that what's in that vial is legitimate? So with talking about literacy development too, she really didn't know how to even formulate a question. So therefore, I will start to ask the question on representing those that we don't know how to even ask. Are you sure this is the right one? And if it's not, then what other options do I have? And then you can talk about as well, did you partake in getting the shot? The vaccine?
Well, I'm going to start up front by saying, yes, I did. The first day they had it available, I was there.
Okay.
But that's a really, really good question because it has so many layers to it. First of all, that trust means that people need to see themselves represented.
Agreed.
In the people who are asking them to partake in this, public health measure. Mm-hmm. It can't just be the same people always telling you need this in a paternalistic and sometimes pejorative fashion. So there need to be people of color who are the doctors, who are the nurses, who are the scientists, and there are African American black scientists who are part of the development of this COVID vaccine, and they have tried to put these faces forward. First of all, I think we have to have that representation.
Okay.
And second of all, it has to be in our neighborhoods. Okay. You can't just have it only in the places where, people that are more economically advantaged are going to be able to have access. Because when people see it in their neighborhood and they see who's getting it, that makes a difference. That they came all the way to us.
So setting up the stations
right.
in the neighborhood.
Setting up the stations in the neighborhood. Mm-hmm. And also media representation of who's reporting on it, too. Okay. It needs to be us talking to us, is what I'm saying. Well, in a 360. Okay. And then I also think that the education that we receive, this is a bigger picture type of thing. We need to understand, STEM better. I alluded to this before, but we've got to understand the science. The nurses at my clinic, and many of them people of color, had a lot of reservations. And what I told them was, this is why I'm not afraid of this vaccine. This kind of DNA, it's mRNA, but it's kind of like the DNA technology. That's not new. This is, kind of basically where the hepatitis vaccine came from. And we've had that for decades.
Okay.
So, we know a little bit more, and we may have added a little bit to it, but this particular type of vaccine technology is not like just like hot off the presses and we're experimenting with the whole thing.
Okay.
We've done this before.
Okay.
And everybody's all right.
Okay.
And you got your kids that vaccine because they had to get it to go to school, and nothing happened. Sure, some people are going to have allergic reactions, but the technology is not a new thing.
Okay.
And then here's the other thing. You gotta know some STEM and make some sense of things. They're not putting chips in vaccines. Can you imagine how big a needle would have to be to even put a chip the size of a rice grain?
Sure.
That would hurt.
Sure.
They couldn't get away with that without you going, that doesn't
Sure.
look. So, you got to use common sense, but common sense comes from learning when you're little things, either on the street or in the classroom. And we just got to understand science. And I teach sex ed. We have a program at Texas Tech along with the Life Center to teach sex ed in Ector County schools. And we've been doing it, this is going on our 12th year. And I teach 7th graders. And they understand where eggs and sperm get together in the tubes and are fertilized. They can understand that. Little kids love science, so you don't have to be salacious to teach it. So, yeah, I think that's a lot of answer to that question, but we have to have representation and we have to have education to be in control of the information.
I think that's perfect. And if all of you really heard as well what she's talking about, and it's really nice sometimes that we talk to our friends about certain things. However, we need to talk to the professionals that actually have the answers to what we really want to know. Okay, let's keep going. This is a really great conversation, by the way. Thank you for sharing so much. The messaging is what you've talked about as well. And then we've also talked about protective masks. If you could really talk about that too. And then the lockdown protocols and then the physical distancing. We're all about that and trying to do those things. But coupled with community-specific concerns, it's created a perfect storm of mistrust, of misinformation. Can you talk about, does the mask really work? Does the distancing really work?
Yes, it does.
Okay.
It does. And I think there are going to be several studies that come out proving that. We've even seen a precipitous drop in flu because we've been social distancing and masking. The type of mask makes a difference, how porous it is, our paper ones that are only 2-ply. I just read an article that showed it protects you for about 20 minutes. So if you do that plus social distancing, that helps. The 5-ply masks that they call the N95, they'll give you up to 2 hours of protection. So you might want to have a little bit thicker one if you're on a plane because those planes are loaded up. And of course we want to travel and see people, and I get it. I totally get it. But particularly if you're vulnerable, I think that is a choice that might not be the best choice right now, but it's going to let up. Even, our hero, Dr. Fauci, has told us eventually we're not going to have to wear these because enough people will be vaccinated to where we'll have a good percentage of immunity. And what that means is that if you have a certain percentage of immunity, the probability that you will encounter someone who can infect you keeps going down, 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 down. And then that way your kids can go to school and not wear masks. So we just got to hold on because this stuff really works. It works, it works, it works. And what you don't want to do is you're playing Russian roulette because younger people are getting more serious disease and having fatalities or dying, case fatalities. But what you really don't want to do is bring it home to grandma. You don't want to bring it home to the people that we know are vulnerable. People who have diabetes and, your Thea that's got kidney disease and is on dialysis. You just don't want to do it. You don't want to do it. So just hold on because I think our normalcy is probably this year.
Okay. Now let's talk about that, and this will be our final question. I'm wondering, because we were talking earlier about the mask and things, can you share what you wear, actually?
Well,
and talk about it a little
I
bit.
usually wear, it's a KN95. It's not quite as protective as the N95, and those numbers just mean they've got more layers.
Okay.
I think wearing any of them is good, and it's going to give you a measure of protection, particularly if you socially distance. But because sometimes I have to see patients and don't know if they have COVID, like if I'm in a hospital situation, I'll even change to a thicker one than this, which
Okay.
is a regular N95. Those are hard to get, but the N95s you can get,
Okay.
pretty much anywhere. And I would recommend the thicker ones, particularly if you're going to be on a plane or, or
Traveling. Okay.
because there isn't very much social distancing on planes anymore because,
That's true.
we're trying to get our economy back together. I get it. So
Okay.
I'm a member of both sides of that community too. So I'm not going to just say I don't understand, but you can do things to protect yourself. Most assuredly, when we have them in the pharmacy, get the shot, get the shot, get the shot, and also socially distance and
Okay.
use mask, hand washing, all the things that you keep hearing. They do work. They do work. Because I've been all over COVID patients and never got it, but I had all the stuff. I have the things.
Now,
So
and you wouldn't just wear the shield because I understand some people will just want to wear the shield and stay because of their allergies. It's hard for them to breathe with the mask. And is this shield just enough? I don't need to wear the mask with it. I have the shield on. And how would you respond to that?
air and the droplets that are in it can get around and under.
Okay.
So I would say if you're going to do that, you might. I saw a little baby and the parents had this tent thing. If you had something that went over your shoulders, like that your top part was isolated, I think that would work.
Okay.
But just the shield by itself, that's going to protect your mucous membranes and your eyes and stuff like that, but it's not going to keep you from breathing in the aerosolized viral particles.
Okay. Thank you. And so my final question to you is, and then if you could share with us some last minute tips on how to feel safe today, that we're going to get back to some sort of normalcy. But my question to you is, are we going to get back to where we were before? Is it normal to not wear the mask? Is this going to be the new normal? Can we have Thanksgiving without the mask? Can I sit next to Aunt Phyllis and Uncle Fred without wearing the mask? Can I go to my friends' weddings? Can I go on spring break like I used to the beach, or go to the mountains, or just to go driving around West Texas? Am I going to have to stop doing those things, or is it coming soon once I take the vaccine?
Well, I want to start out with a little humility because I am not an infectious disease expert like Dr. Fauci or our dean, Dr. Burke, who, is an infectious disease expert up there in Lubbock. But my sense of it is, as a physician, that yes, we can get to a sense of normalcy once we have enough percentage, and you can look it up in the CDC what that number would be, where the likelihood that you're going to encounter somebody that can infect you is low enough to where we can relax our social measures. Now, the caveat is it depends on our behavior, because if we're not going to get the vaccine in enough numbers and we're not going to socially distance, it's going to take longer.
Okay.
And we're going to have to suffer longer of being isolated, having our kids out of school, which we know is not the best way for many kids, especially kids with special needs. I think we know that it's a complex problem, but you cannot ignore one part of it, and not do the rest.
Okay.
We've got to look at the economy, the schools, all of that, as well as what is our priority, and that's to not, golly gracious, if we can help it, reach that 500,000 number of dead people.
Yeah.
This is real. I'm so sorry for the misinformation, but this is no joke. Now, in the future, I think we do have a new normal. And I think we already knew we did before COVID.
Okay.
This is why, and I'm not just trying to be political, but this is why infectious disease experts went to President Obama during his term and said we need a pandemic preparedness plan.
Okay.
And he appointed an entire panel of people to advise him on that. And we had started on that work right here in Texas. We had a scientist at Baylor, a woman, she's originally from Italy, who was already working on the vaccine for versions of COVID. And everything stopped,
Okay.
in the last administration. That just wasn't wise. You know, and it's not from, I'm saying this as a doctor, not politically.
Sure.
That we have to be, I think we're going to be more savvy in the future. This is not the last time this is going to happen.
Okay.
You know what I mean? So we may have to do this in the future, but if we do it right, we'll shut it down quickly, the way they did in China, the way they have in, you know, places like Norway and New Zealand. We'll shut it down and our lives can be reasonable. But I think that's why we need more science education, so we get it and we don't start like, oh, I need a haircut. No, what you need not to do is die.
Yeah.
You know what I mean? So I'm just trying to be pragmatic about it.
Perfect.
You know, this our new normal had already begun during SARS, you know.
Earlier on.
Yeah.
Much earlier.
Yeah.
Much earlier.
We just weren't listening.
Right.
Right.
I hope everybody heard that. This is really great information. Oh my gosh, Dr. Pruitt, thank you for joining us. And I appreciate all of you joining us as well. And one thing to really remember too is not only are you protecting yourself, but you're protecting your neighbor, you're protecting your family, you're protecting friends, your coworkers, etc. Wear the mask, wash your hands, keep the social distancing going, and let's see what's going to happen in West Texas in terms of saving lives, because we know we want to do that. What this conversation has started, let's not let it end. Let's let the Henrietta Lacks book, let's use it as a text and answer some questions from whatever you're coming up with as you're reading it. We're reading it all this month. Here it is again. I want to share it with everybody. Don't look at my stickies in there. That's what I do with my books, and some pivotal things that I want to remember and make notes of as well. But literacy development is key. Knowledge is a very powerful tool to change and transform your life. So let's use that well. And if you could leave us with some last minute tips, even though just before wow, stop it. Put your mask on and things. But if there are some other tips you'd like to leave, maybe one or two, that would be great. And then we will call our interview time has ended temporarily. We will certainly get into your office and ask you some more questions as well, because you've brought us to a point where we can and feel safe and feel protected and shielded and feeling a bit more knowledgeable as of today.
Well, it's our love letter, like this consensus letter and statement, you know, that this is what we're supposed to do as medical professionals. But what I would say is just get information and get it from good sources. Sorry, that doesn't include Facebook. And Dr. Google. Use reputable sources.
Yes.
This is emerging science, so sometimes there may be changes in it. Keep up to date. Know for yourself. And if you don't understand, come ask us. But you need the information, because information is power.
Thank you. Thank you. Thanks for joining. Until next time.